and I will move us on to our last speakers of today, of this session, Lamea Samad, who's Senior Evaluation Analyst from Suffolk and North East Essex ICB, who will be talking about evaluation planning and implementation, adapting analytical approaches for complex health problems and interventions. Hi, Lamea, I can see you on screen. Shall I hand over to you?
Yes, hello. Thank you, everyone. I hope you can see the screen because at the moment I can only see the slide on its slideshow.
We can see the slides. They're not quite on slideshow at the moment.
Is that any better?
It's not shared for me. We can see it if we can't get it any better. Should we run with it as that? Just want to make sure that you.
Sure. Let's just run with that. Or if I just very quickly, let me just do that once. Okay. Any difference, or it's the same?
Not seeing the slides at all at the moment. Chris, come to the rescue. Oh, you're on mute, Chris.
I'm muted. Sorry, I'm muted. I can't see your slides now, Lamea. Can you maybe just try and share them again?
Sure.
Yeah, there's nothing coming up. It's a shame because we had them on screen, didn't we? And we seem to have lost them now. I can't really explain it. Oh, no, hang on. Something's just popped up. Add it to stream for others to view. Where is the flaming thing? Oh, it just says you stopped it.
Oh, did I?
Well, I don't know. Maybe maybe just try one more time.
Okay, final time. Okay, there we are.
Yep, that looks very promising, actually. Here it comes.
Okay, good. All right. Can I just start off? Fire away.
Yeah, sorry, I left too early then. Yes, go ahead.
Okay, all right. Well, thank you, everyone. I am Lamia in the intelligence function team, and this is the Suffolk Integrated Care System. Any problem, please just give a shout because I can only see the shared screen. So just a very brief, very quick sort of outline. And as the topic says, I'll be talking about evaluation planning. That has been said so far since the morning sessions, and how we can adapt analytical approaches for complex health problems and interventions. Now, before we move on further, what is the problem? As we know in the Health and Care Analytics Conference theme, it's rising to the challenge. And my very first question to all of you is that what do you feel is the main rising challenge in your experience as data analysts, as the experts? Well, when I started in my role as a senior evaluation analyst, this is how I felt. However, what we did is that it was where to start, really. So we had conversations with colleagues and collaborators that included clinical teams, project managers, and data analysts. And some reflections, as you can see in this empathy map, is that there is too much yet too little out there when it comes to health and care evaluation. And there was also amongst our data analysts, there was that concern that the project question or the problem statement needs to be very clear so that it can actually inform a very clear data analysis plan.
Hi, Lamia. Sorry to interrupt. The slides don't seem to be moving on, which I guess is related to the problem with sharing them, isn't it? I don't quite know what to suggest.
Okay. Um,
We're coming up to lunch, so we don't need to panic. We can have a few minutes fixing this problem
yeah,
and then
sure.
just run
One
right until.
final sort of attempt, and I think when I converted into a slideshow, that's where it's going a bit bizarre. Um, okay, if I just leave it here, how is this?
Yeah, so people are saying to me if you put it in slide mode before you share it, yeah, that still doesn't look like. So if you press F5, what happens now? When you're on PowerPoint, if you press F5, what happens?
Um, it doesn't convert to slide mode.
Hmm.
So is it not coming at all?
I can see the slides, but I think well, I'll put them on screen. So I think it'll
Hmm.
do the same thing again where it won't progress. I don't know whether you can. Oh, hang on. Oh, yeah, here it is.
Okay.
Um, are you able to move between those slides as you talk? Because it wasn't doing that before, but
Okay.
maybe
Okay. Shall I just continue from here?
yeah, maybe try that.
Hmm. Okay. So so that's where we were. So rising to the challenge, can that be seen?
Yeah, we're all
Okay.
good. Thank you.
Okay, good, good. So, in terms of, again, just to very briefly recap, so the conference theme is rising to the challenge. And my question to all of you was, as data analysts, what is the challenge that you feel you are experiencing in your roles, primarily as analysts? Or, and then I moved on to the slide. This is how I felt when I started as an evaluation analyst in the job role. So what we did was we had initial conversations. Where do we start? And that was with a wide range of stakeholders, which included project managers, leads, analysts, and these all things came up in the empathy mapping that we did. For example, there is too much yet too little out there when it comes to health and care evaluation. And also amongst data analysts, the concern that there needs to be a very clear project question that informs a clear data analysis plan. So if we go on to again focusing on the complex health problems and interventions within the rising sort of financial uncertainty, what do we mean? Just to very briefly touch upon what we mean by complex. And in this, I'll just give an example, which was given very, very elegantly in a paper, that raising a child is an example of a complex sort of intervention, if you call parenting an intervention, because A, formulae have a very, very limited application, as we know, if only we had a parent manual, and B, all the expertise can help. There is greater unpredictability in success or outcome, as two siblings are never the same. So, in terms of briefly touching upon complex health interventions, these have been described as having multiple components and their interactions, and how I think challenges in how to measure outcomes amongst multiple interacting components with non-linear, as we say, causal pathways, where the cause and effects, if only they could be in a straight line and we could show the impact. And this very complexity has been captured in the latest, and I think one is due shortly, in the Medical Research Council framework, which was published by the MRC and the National Institute of Health Research, where there is a much greater emphasis on recognizing the crucial role of context and what we take that within the evaluation perspective in the core sort of central area there. And then just to talk very briefly on the strategic commissioning framework that was published a few weeks ago, highlighting the role of evaluating impact, as you can see, a very central role, and where strategic commissioning really starts by assessing the needs and the context, as in needs embedded within the context. So, the initial discussions and the empathy map led to a better understanding of a gap between what were the challenges that were being experienced in evaluating, and what were the aspirations. And that's where there is a need to renew the existing strategy. And as a very first step, we published a co-produced evaluation guide, which was to plan and implement evaluations in the integrated care system. And the main purpose of this was to enhance analytical literacy amongst non-analytical professionals. And number two, to embed evaluation planning as early as possible into strategic commissioning. And that by early as possible, I meant as part of project development rather than as an ad hoc sort of step later on. So the evaluation guide sets out a three-staged framework, which includes scoping, co-designing a theory of change and logic model. And then we have the third one, as you can see, is the data analytics stage. And all this is very iterative rather than being linear. And some of the guiding principles that we have included in the evaluation guide, including that complex systems are not linear, and therefore there is a need to adapt the existing analytical approaches. So this I've just taken out from the evaluation framework, which is the focused third stage of the framework on data analytics and dissemination. And as you can see, we have tried to cater this to a wide audience, non-analytical, inclusive, and to really break down the steps into a very hands-on, meaningful way that can be applied straight away. And as part of data collection, the guide has very clear, simplified tables as to the type of data, along with data analysis. Now, just to briefly touch upon the results as in practice. So, as we know, the uptake has increased effective evaluation planning. It's brought much greater awareness. We've had project leads and managers at the very beginning of, as we say, the project conception to be having conversations about evaluation planning. And this is informing higher quality decisions. Along with webinars, the guide is also serving as a blueprint that is being used in strategic commissioning. And for example, a complex, as we say, the wicked problems, public health problems that are the challenges to address those. And for example, reducing health inequalities, where we are embracing the process evaluation along with to complement impact evaluation. And as you can see here, although very small, but just to give you a feel that the process evaluation includes clearly defined process indicators, outcomes, along with the inclusion of qualitative methods that complement quantitative evaluation. This is all part of the planning that we are actually including in practice. And the guide, the evaluation guide that we've published, has introduced concepts of, along with, of course, co-production, it has introduced concepts of the crucial role of systems thinking, which is as a holistic approach for complex problem solving. This is something that we've already worked through, and we continue to build on systems, as we say, from thinking to systems doing. In one of an example as a next step, perhaps that would be in a priority project commissioning to support people with sexual violence and abuse experiences in Suffolk. So finally, just to conclude and to catch up with the time lost, really, I'd like to highlight here that along with the inclusion of a systems doing, it is also about having analysis in the very broader sense, and that includes the shift towards a systems-based logic model that includes the contextual influences. So, as the conference theme is about rising to the challenge and analysis at the very heart of health and care systems of the future, so my second question to all of you is, how could you, as data analysts, adapt existing analytical methods that actually address the complex health and care problems within complex systems. And for example, as I mentioned, that we are already looking into looking at systems thinking in as a mindset and methodology. So, for example, having systems mapping as an evaluation tool to visualize and to understand the present state, as we said, of the defined system. And this also really includes my final slide is about, as we discussed in the morning, that there were questions about evaluating impact. And one that sort of stayed in my mind was, has it made a difference? And that's where we need to adapt the analytical approaches that actually embrace the health problem complexities, as we say, within complex systems as early as we can. Thank you. And any questions and feedback, very welcome.
That's brilliant. Thank you very much, Lamea. And you coped brilliantly with the technical challenge and have brought us pretty much back on time. So there is and lots of food for thought for that from that presentation. There is one question in the Q&A, which is really about sort of roles and responsibilities. So do you think that program leads should lead on better evaluation methods, including setting out the problem statement, or is that better done in partnership with analysts?
Better done in partnership with analysts.
I'm not sure if that might have been a loaded question, that one. Yeah, I don't know if you want to say a little bit more. I was wondering, I mean, I think your evaluation guide is fantastic. I also almost wondered whether it means that there's a lot more people coming to your door to seek support.
I think it's about, evaluation is about the added value, and it's about change, but again, change for the better and within the constraints, and again, coming up with the good enough. As again in the morning, I remember there was something about, rather than having the perfect answer, we need to be asking the good enough questions here. So I think it's about really looking at it as a collaborative approach. And when one steps into change, it's about stepping initially into a bit of discomfort. And yes, it does mean a lot of time invested in the initial bringing that awareness and trying to bring, as we say, a developmental evaluation in collaboration with project leads and really sort of thinking through and anticipating the unintended, as we say, consequences again from the very beginning. But I feel that that is time worth invested, because the entire point of our renewed strategy is to, and this guide being one of those simple, humble steps towards that direction, really, of the systems, as we say, we work towards the direction of change rather than achieving the sort of impact. So I feel that time is worth invested, and it's part of creating that shared ownership with all, really. And that's the entire purpose for this guide to be the first step.
Brilliant. Thank you. There is a question. Is the guide available and publishable?
Yes, so we have the web link there, which was probably a very small, as it wasn't in a slide mode, but that's something that we have on our integrated care system website. And we are looking to build on that. As I said, we are already working into our systems, from systems thinking to systems doing. So that is something we look forward to sharing in due course.
That's brilliant. There is another question in the Q&A, but I think we've probably got to close it there. But fantastic. Please, if I can invite everyone to thank Lamea for a fantastic presentation. And in fact, all